Hello, I'm Mansur Ahmad. I teach radiology at the University of Minnesota School of Dentistry. I invite you to my teaching files of oral and maxillofacial radiology. I bring to you selected cases from my collection of thousands of interesting radiographs. These are cases that will help you improve your diagnostic skill. Some of these cases are easier to interpret. Some are, I guess, rather challenging. But every case will have something for you. This video contains basic information on radiographic interpretation. That is, how do you describe a lesion that you see on a radiograph? Interpretation of any radiograph is based on a systematic way of describing. Never underestimate the power of a good description. Most lesions can be described in less than 2 to 3 minutes. Really? 2 to 3 minutes? Yes, sometimes even less than a minute. This time is worth investing. Remember that in real estate, the 3 key words are location, location, and location. In radiographic interpretation, the key words are description, description, and you got it, description. Description is not difficult. Even elementary school children describe things regularly. This is show and tell. In radiology, we do the same thing, show and tell. We see features and we tell about it. Easy, easy. Just needs some practice. So how do we describe a lesion? There are 7 main radiographic features of a lesion. Just 7. Practice a few days and it will be a second nature to describe a lesion quickly and thoroughly. First, we'll describe the location of the lesion. Is the lesion localized or generalized? Is this lesion on this radiograph in the maxilla or in the mandible? Is it in the anterior region, around the root? Or is it in the mandible, associated with the root apices or with the crown of a maxillary left premolar? Is the defect in the body of the mandible or the ramus? Right or left ramus? Involves the anterior margin or the distal margin of the ramus. The second feature that we'll describe is the density. Is this lesion radiopaque or radiolucent or mixed density? See, it's not difficult to describe, right? The third feature that we'll describe is the size of the lesion. In some images, such as a CBCT scan, we can measure the size in millimeters. Not so on a panoramic radiograph. On a panoramic radiograph, we'll give an approximate measurement. Since panoramic radiographs are often distorted, these measurements may be, for example, the lesion extends from the apex of the first premolar to the distal root of the first molar. The superior margin is near the crest and the inferior margin is near the mandibular canal. This gives you an idea of the size of the lesion, although I did not give you a size in millimeters or in inches. The fourth feature is the shape of the lesion. For example, is this lesion circular or oval? Maybe you will see an entity that is linear or teardrop shaped. Fifth, we'll describe the border of the lesion. Is it well defined or irregular or corticated? Maybe not corticated. Is the border continuous or disrupted? The sixth feature This is a radiographic feature that we may not see in every lesion, and that is the content inside a lesion. What is the content in this lesion? Is there any radiopaque content inside this lesion, or multiple radiopaque entities? The final feature, and a very important one, is the effect of the lesion on the adjacent structures. Is the third molar displaced? Is the mandibular canal displaced? How is the alveolar crest? Is the premolar rotated and displaced? Is the palatal cortex intact? How is the sinus floor? Is it eroded? Why is the canine still upright? How is the condyle? Is the surface of the condyle flat? Are the roots of the maxillary anteriors flared? Each of these radiographic features will tell us a story, will give us clues in making a diagnosis. I'm absolutely sure when you practice these 7 features, your radiographic diagnosis will become much better. Thank you very much. Please come back again and visit my radiology teaching files.